Welcome back to another episode of You're Not Alone podcast. I'm Val.
I'm Morgan.
And today we are joined by my good friend John, who is going to share his story today. But before we get to the serious business, hi Morgan.
Hi, how are you?
Good. I'm better now that you're sort of kind of back.
Yes, no crutches, still using the brace, but not bad.
I've missed you.
I miss you guys.
Terrible.
It's been
Terrible.
You
It's
don't
been
really
okay. We still are doing the thing and helping people, but it's not the same whenever my other brain cell's not here. So it's like, you know, yeah.
You always have to be working at the same time versus I would take the load and then you would take the load.
Mm-hmm.
Yeah.
And we're kind of like a comedy show.
Yeah.
I mean, even the patients are like, when is Morgan coming back? Because this show is not as nearly
it's not as
entertaining here in the clinic without Morgan, you know, to bounce off one-liners and we go back and forth. But, yeah, so Morgan should be back sometime next month.
Yes, second week in December.
This is November. We're moving into almost mid-November already. And then, of course, we haven't recorded because you've been focusing on healing, and that's more important than anything else. And so, yeah, we will catch up another episode of Morgan's recovery because it's not typical with having spinal cord injury. And then for anybody who's listening today that did not listen before, is that Morgan has a spinal cord injury, and she also just had her ACL repaired on her affected side.
Yeah.
So it's not been a typical ACL recovery, and it will not be, I'm sure. But yeah, so we're just kind of, I have it mapped in my calendar of the weeks and when I got to bubble wrap her and make sure she stays safe. But yeah, we'll talk about that probably on the next episode.
Yeah.
But, yeah. Okay. So I am going to lead this episode with saying that the box of tissues is handy. Anybody who's watching the podcast is likely to see my snot at some point today. You know, I might cry.
Or hear it.
Yeah, you might hear me slinging snot. That's just the way it is. But today is a little bit more of a serious topic. And I'm going to let John go ahead and tell you guys all about that. But let me tell you first about John, how I met John. I met John the day that Chris and I showed up to A.T. Still University here in Mesa to talk about our story. And after every single presentation, there's always like a few students that'll come up that were too timid to ask questions. And I'm not saying you're a timid person, but I'm just saying some people are a little bit afraid to ask the questions during the presentation. And then they'll come up afterwards. And so you and a couple of your classmates came up afterwards and you were like, hey, I'm coming to your clinic here to do the ice rotation and all that. And you were very charismatic. Okay, you're an approachable person. And I think that your past experience with your military service and everything else kind of gives you that advantage to anybody else. And he's got like this epic red beard. So I mean,
the beard is great. I mean, I wouldn't say approachable just because usually no one can see my emotions under the beard. So I wouldn't say I'm approachable by any means, you know, because I don't show any emotions of smiling, frowning. You really can't tell. So
they're like, what's going on under there?
Most definitely, yeah. I mean, that's 100% accurate.
That's awesome. So, yeah. So John, I want you to share a little bit about your background. How we of course got to meet. I kind of gave that away, like we met at AT Still, and but a little bit of background on yourself of how you got into starting out your military time, and then kind of lead that into PT school, and then we'll lead that into where we are today. Okay?
Definitely, sounds great.
Right, awesome. Take it away.
Yeah. First of all, thank you for having me on the podcast. I appreciate it. So joined the Army right out of high school at 17. I was actually trying to become a professional video gamer. That didn't work out that well back in 2005.
My son needs to listen to that part real close.
That was in 2005, so I mean that wasn't really a thing at the time. But I actually did skip a bunch of days, and I had the ultimatum. My mom did was to either repeat the year or they would kind of just let me graduate because they knew I was joining the Army. So I mean that's kind of how I got through high school. 17. I was in the military for 11 years. I was stationed at Fort Drum, New York for 8 years, majority of it there. And then the last 3 years I was stationed in Fort Benning, Georgia as an airborne instructor.
Wow.
So I got to teach people how to jump out of airplanes and all that stuff. It was a good time. And then, you know, I wasn't married or had any kids at that time, and I just started to think if I was going to start a new chapter in life, now would be the opportunity to do so.
Mm-hmm.
So I decided that it was the time to get out. You know, a lot of people at 11 years, it's like, man, you should have made it a career, or why didn't you stay in? But I just didn't feel that there was a really good fit in the military at that time, with a lot of things going on in 2016. You could just see a culture shift, a dynamic shift, and I just really thought at that point that it was just time to kind of get out and just start a new chapter.
I'm going to warn you, if you fidget, this is why I get stuck in a stationary chair.
Okay, yeah, stationary
If you
position.
fidget, we're going to hear you.
Gotcha, I'll kick my leg out
Us
like that.
ADHD people, Morgan's guilty of it
I
too.
have a little cord to play with.
All right, cool. So I did not know you were Army Airborne.
Yes, yeah.
That's awesome. Awesome. Wow. How many jumps do you think you've done?
Oh, so...
Especially being an instructor. Or do you just push them out? You
well,
don't have to, you don't have to do it.
no, we do get jumps because, you know, like once you become like a jump master, you're up there with the students, getting them out of the airplane. It was frowned upon to push students out of the aircraft. You couldn't really do that at a certain point, which, you know, that comes with the culture shift also in there. But I mean, I went there with 5 jumps because, you know, I graduated airborne school, I think in like 2009. I went back there in 2012, 2013 with only 5 jumps, and it was like, oh man, like this is a return. And I think maybe within the course of the 3 years that I was there, I think I jumped, I think it was like high of like 60, 65 times.
Wow.
I mean, so it was it was a good time though. I mean, out of all the experiences that I had, I think I had, even though every day was Groundhog's Day there, I mean, I had the strongest group of friends and bonds that I made there. And it was just, you know, like the saying in the military in general is just, you know, if you're going to go through the suck, you want to go through the suck with people you at least enjoy. So
Right.
No, that's
Yes,
true.
Thanks, Morgan. Right.
Yep,
right.
yep.
Full circle. That's awesome. Okay, so you said three deployments?
yeah, 3 deployments. Yeah,
Okay.
twice to Iraq and once to Afghanistan. So first time to Iraq was during like the surge. So we actually got extended 15 months. The second deployment, I want to say was like 9 months. That was kind of like the re-drawback of Iraq. And then in 2012, I deployed to Afghanistan for 9 months, which was also during like the retrograde time of them trying to move troops out of Afghanistan and pretty much have like the Afghani army take, you know, more so of the lead.
Yeah. Well, I hope they did a better job of taking that lead than Iraq, because that was what Chris had told me. He's like, you know, we're trying to train these guys to take over, and
Correct.
it didn't go well.
No, I mean,
we rolled out and they rolled out too.
I mean, I think, you know, I can't remember the year that it happened, but I mean, it went back into the arms of whoever anyway. So
Yep. Yeah. Okay, so you get out. You clearly moved to Arizona. So
yeah,
is that when
I moved out to Arizona just because, you know, I came out here to kind of help my mom out or just be with my mom. It was either that or, I mean, I really don't know. I could have went back to Florida and hung out with friends or done that stuff, but I kind of moved out here just because, you know, growing up, my mom was the one that kind of looked out for me. You know, she was a single mother, and so I came back out here to just kind of spend some time with her and just kind of give back, you know, being with her.
That's awesome.
Oh, yeah.
So
Very cool. She sounds pretty cool. I've seen a couple of her comments on some of the things in your Facebook. I'm like, she's got a good sense of humor. So
yeah, definitely a good sense of humor and very straightforward. So
Good.
she'll tell you what's going on.
That's good. I think that's a strong quality in people. You went to ASU,
I did.
right? That was
Yeah.
to get your kinesiology
Yeah.
or exercise science.
Bachelor's in kinesiology.
Okay.
Yeah.
All right. So that being said, I came across, you had an article written about you while you were at ASU, and it kind of goes into the fall 2021 graduates, and that in the article you're actually talking about making that transition to A.T. Still University. And so I'm going to read a little bit of this because I think that it's awesome, and I wish I could give credit to whoever wrote it, so I apologize if you're listening or if you catch this. I really wanted to give you credit, but I could not find your name anywhere on the online article. So I do believe in giving that credit, so you did a great job with this article, but I'm going to read a little bit of this. So, U.S. Army veteran John Wynkoop had 2 separate but related experiences that set him on his path towards changing the future of health. His first was as an active duty service member when he met a couple of physical therapists who worked on him and other soldiers. They made a lasting impression and showed me that there is more than just a practitioner-patient relationship when it comes to the healthcare system, he said. It's really about forming a connection based on relatability and compassion. His second was as a military veteran and far less positive. And he goes on to say that he's had poor experiences dealing with the Veteran Administration healthcare services, and he wants to find ways to improve it for others. He would love to give back to the veteran population and ensure that they're getting the treatment they deserve. And as the article goes on, I'm getting caught up in my feels a little bit because you know how I feel about our veterans. And so, yeah, let me find the spot that I wanted to. Right here, you were asked, what is the best piece of advice you'd give to those still in school? And it is to don't let adversity define you as an individual. If you fail at something, don't let that define you. Learn from your failure and come back stronger and ensure it does not happen again. And then you also had mentioned when approaching healthcare and impacting others, you have to have an open mind and place yourself in other people's shoes to see how they view health and approach it that way. I think people fall into a trap of thinking that it's just because they are active or healthy, it should be easy for others to do the exact same thing, and that simply is not true. So, you already, leading up to this point today, we're talking about helping veterans and understanding compassion and empathy,
yep,
and how that would make you the best practitioner that somebody could have. And I think that's what I like about you. You were here with the ICE program, volunteering your time. I don't know if it's volunteering necessarily for the program, but you get those hours.
Correct. Yeah.
Voluntold. Yeah. It's just like being in the military.
Yeah.
It's you put those ICE hours in, and those are considered pro bono with patients that might need a little extra assistance, maybe need more hours of care than what their insurance will cover, and those kind of things. And of course, me working for Gateway's HUD clinic with the pro bono clinic, you're my kind of people, right?
Yep.
So you got lots of things. You got the beard, you got the veteran service, the cool PT,
empathy,
the empathy, the compassion, and all. So, what did you think of PT school?
I mean, I enjoyed it. I think it's kind of like the same thing, though. It's what you do to form the bonds with the individuals that you're with. I mean, I don't think that it's enjoyable to have to learn certain things and just kind of repeat them on a test. I'm not a fan of standardized testing. I don't think that's an accurate way to measure an individual's ability to do anything, especially in a hands-on profession like physical therapy. I mean, obviously you have to understand the material, but I think that, with skills and things like that you do go through in physical therapy school, I think that's a better way of assessing the individual rather than just seeing what they're going to score on a standardized test. Mm-hmm. So going back to, did I enjoy physical therapy school? I think it was the hours that I spent with the individuals studying and doing hands-on training. I mean, AT still has a great group of professors that, I got to work with. So I did enjoy my time with, those professors. But I think everything is just what you make it. So I think, finding individuals that are like you, finding your people, and then going through something that's not fun still is going to make it enjoyable. Yeah. So I think that was the biggest thing that I enjoyed with physical therapy school, and more so just the hands-on approach. I really like the pro bono clinic too there at AT still. Mm-hmm. I think it was a good time to just kind of get in to see individuals, but also in your first year, you're kind of watching. In your second year, then you're taking the lead. So the more time that you spend in the pro bono clinic, the more it's going to set you up for success to be a practitioner. Mm-hmm. So, I mean, really like using that time to get in there, I think it was great to and those individuals are coming in who they might not have the health insurance, or they might not have whatever to cover that cost of physical therapy. So it's great working with individuals that they need it, but they might not have the access to go to it. So
right. Yeah. what subject did you fall head over heels for? I'm sure every time I go, I say,
Yeah.
who wants to go? Who knows what they're going into? And it's like all the hands go up. And
Correct.
90% of the time, it's ortho. I want to be a sports.
Yeah.
Sports.
Yeah.
Go
I want to be
sports. You know.
a sports bro. Yeah, I got that.
And you got a background with CrossFit and all this other stuff too. So
I mean, I didn't want to go into ortho just because, no offense to any ortho physical therapists out there, but I mean, I just felt like it was very like mundane. I mean, it's, you know, if you're not saying that there's people out there that do it, but there's a lot of people that just go by this for this, and then now you're falling into that trap of just treating individual as a group instead of catering and treating an individual for that person itself, instead of just saying I didn't want to use the term cookie cutter, but yes,
I'll throw
you know,
it out.
and I'm not saying
Everybody.
that every ortho physical therapist is like that, because I mean, I've met some great ortho physical therapists, but I can definitely see how it's very easy to fall into that trap of, oh, I'm seeing someone with a total hip or a total shoulder, and now you're just falling back into those protocols, and that's how you're going to, you know, rehab that individual. So I mean, I really didn't want to go into ortho. I really enjoyed neuro, and you know, it wasn't more so of who was teaching neuro, because I mean, I had a lot of great professors that were teaching ortho and anything like that. It was more of the content that I was learning that I just thought was more enjoyable, because I feel like it's more rewarding. You know, you have an individual that had gotten, you know, either a spinal cord injury, or, you know, now they're paraplegic or something like that, and, you know, you work with them for 2 years, and then you finally watch that they're able to do something that they used to be able to do. That's more rewarding to me than having someone who came in with an elbow injury and getting them back out there to golf.
Yeah. Right.
So that's why I enjoyed neuro in general.
Yeah.
It was either
Celebrate
neuro
those
or
little
it
wins,
was
too.
it was
Like,
either neuro or it was like pain science, because
Okay,
I really enjoyed the mind approach to physical therapy. And just, you know, if I didn't go to physical therapy school, I was actually going to go to sports psychology school.
Oh, wow.
Just because the mindset and the mind in general was just very, it was just interesting.
Yeah.
You know, how someone's mind has the ability to control something as opposed to just their physical ability.
Right. Right. Okay. Now you graduated. You are licensed.
Yep.
You're a physical therapist. Congratulations on
Thank you,
all
thank
that.
you.
Doctor.
Yeah.
Yeah, thank
Dr.
you.
Wynkoop. All right, so where'd you go? What'd you do? What'd you start out with?
So I did have my first job out was at the Citadel in, you know, a skilled nursing facility.
We talked about this a
it
little bit the
was-
other day.
That just, we'll leave it at that wasn't my jam.
Yeah.
You know, I have nothing against, I'm not going to say anything negative towards long-term care facilities. You know, obviously they're needed. You know, do I think that there should be a little bit more of a microscope on how they operate? Probably.
100%, yeah.
But I'm not just calling out that organization
Yeah.
in general. I don't want to get
It's a
like
lot of
sued
them.
or
Yeah,
anything. Like that.
yeah, I
Like,
know you're.
It's the general
but I mean, that
consensus.
just wasn't my jam. And I'm gonna say this honestly, I don't know if it wasn't my jam just because at that time I was going through everything. You know, that's when I first started to understand that something sinister was going on in my body. So I can't say that, you know, because I had a great physical therapist at the Citadel. I mean, she was amazing with the individuals that she worked with. So I just don't know if it wasn't my jam or just maybe my body just couldn't tolerate what it needed to do. And I didn't have the mindset at it because I was going through my own kind of stuff at that time.
Yeah. So what started happening?
So at that time, I just started to get very like rigid, like having muscle cramps, fasciculations, which fasciculations is like your muscle is firing even though I'm not doing anything. So just sitting at rest, you know, you look down and you can kind of see like your muscle is twitching. The cramps I can only describe as it was just, they were just rigid. It was like my muscles were like locked on, like, you know how individuals have like locked jaw or tetanus or something like that. Like that's how my muscles felt. So obviously you can see if I'm trying to move someone from the bed to their wheelchair or the wheelchair to the bed, you know, it was very uncomfortable. And then there came to a point to where I just didn't feel safe doing it anymore.
Yeah.
You know, and that's when I was like, I need to get out of this. I need to try to find something else.
Okay.
You know, and I landed on Racovia, which was that program. There should be more like it. I mean, it's like a mind-body program of individuals that have anxiety, depression, PTSD, substance abuse, and you know, they mirror all that stuff with you're going to see not only physical therapy, but you're seeing like a psychologist, and you're getting tools so that way you're going to be successful.
Yeah.
That program to me is, I feel like there should be millions of those programs around.
Yeah. That's the only other place that I can say that has kind of caught my attention. And if I wasn't here, that's kind of cool. I like that multidisciplinary.
I mean,
approach.
it was great. And I mean, at that point, you know, the physical therapist that I was with, and the PTA that I was with, they were amazing. And they actually kind of started to help me through this journey of something's not right. Like, you need to reach out to your practitioners. And at that time I had my own insurance also. So they were like, you need to get a referral for Banner or something, because you need to get seen. Like, if you feel like something's not right, because if I didn't get the ball rolling, I would probably still be here not having the ball rolling, just because, I mean, you don't know.
Right. Yeah.
You know, but I did know that something was just not right with my body.
Right. Okay, so those are interesting symptoms. Let's just lead with that for now. And then where are you at as far as like what testing have you done?
Oof.
And what are they? What testing have you done, and what testing have you not done yet? Well, let's put it that way. Because you're kind of I don't know if in limbo is the right words.
No, that's the right word to use. I mean, it's like you're stuck in a gray area. And you know, when we do end up talking about, you know, motor neuron disease and amyotrophic lateral sclerosis and stuff, you know, you'll probably explain it, but unfortunately that disease is a rule out. You have to rule everything else out before you can rule it in, right? And unfortunately, if you're in the starting stages of it, your tests are going to come back somewhat normal.
Yep, and that's where you're at right now.
Exactly. So, I mean, sorry, I have to clear my throat. You know, these symptoms started in February, and they catered it up to anxiety and panic attack because I had, you know, the MPTE, which is the board examination for physical therapy, coming up and all this stuff. And people were just like, oh, it's a new chapter in your life. Like, you know, that you're right to feel this way. And, you know, my healthcare provider over at the VA was like, oh, yeah, it's, you know, it's definitely anxiety. So, I mean, I went through all the testing for cardiac and everything came back normal. Right. But I just still didn't feel right. You know, and the biggest thing that I'll continue to advocate for is I don't know your body, you know, so when individuals would come into me with physical therapy and they're like, this is what I'm feeling, you know, and that's what they're feeling, and you have to respect that. You know, you have to understand they know their body, you know, so that's what I would say is like, something is not right. I know my body, and I don't know if maybe in February that my body was just trying to tell me something is not right, and those were the panics, like those were the signs. You know, it was anxiety. You know, so going back to testing, I mean, I've done upper and lower bilateral EMG, which is, you know, nerve conduction testing, which is one of the ways to pretty much, it's like the gold standard for ALS. You know, the only problem is like I said, if you're in the beginning stages, it's not going to show. It's going to show as normal motor recruitment or anything like that. I've done like 3 swallowing studies. I've done MRI, CAT scan, CT scan. You know, I've done everything for my heart. So all the scans that you can do for that. I've done, trying to remember them all now.
Lungs, pulmonary.
Oh yeah, pulmonary function test, which was the only thing that came back abnormal. You know, and right now, you know, a month and a half ago, I was at 69% for a pulmonary function test. As a 38-year-old, that's not normal.
Right.
You know, and unfortunately, somehow the VA, you know, dropping the ball like they do, they marked it as a normal pulmonary function test. Which that still blows my mind, and it'll continue to blow my mind until whenever, you know, is that a 69% pulmonary function test that's abnormal. I mean, that's, you know, I should have had up in like the 90s. So that was the signature of pretty much that something was going, wrong. I think the only test that I haven't done would be like the lumbar puncture test or a muscle biopsy.
Right.
Oh, wow.
So I've done everything else.
Yeah. And those are going to be tests that are last reach. That's going to be their last ones to want to assess.
I mean, those are the ones that, that's like the last line. I don't know if the VA does it, but I mean, if you go into ALS clinics in like Barrow or Honor Health or those ones, that they usually do that type of stuff. Unfortunately, when you go outsourced to these places, you repeat the test because they're going to trust, which is understandable. They're going to trust whoever their individuals are. Right. And I've also done almost every blood test that you can think of.
Yeah.
That was another thing too.
Yeah. So you have an upcoming neurology appointment, right?
Correct. Yeah, the 25th I have. And I'm also trying to get into Honor Health as a second opinion next week, hopefully.
Yeah. And they do have an ALS clinic there as well, right? Or specialist?
Correct. Yeah. They have an ALS specialist, yeah.
Okay. So can you explain, we talked a little bit about it the other day. So John popped into the clinic to come say hi to me. And I asked you, not to be condescending, of course, but my question was to make sure I iron out the understanding process of who's saying yes, who's saying no, and who's shutting you out and who's letting you in, right?
Correct, yeah.
And I said, okay, so why aren't they calling it this? And you said because they need to have it clinically diagnosed with a neurologist, and, and there's certain steps we got to get to, right? You and I are on a proactive, let's stay ahead of the curve and make sure that if that's what this is, that we stay ahead on treatment and getting you strong and doing whatever we can do to prolong, if that's where we're going, to prolong this process and improve where we can make improvements. Theirs is a wait and see process, and how many times has that worked out for us, right? So currently, I asked you the other day, so if they don't think that it's ALS, then they would think that it was, you said PLS, right?
Correct.
So that is primary lateral sclerosis. What would be the difference?
So the difference between the two are ALS, which is amyotrophic lateral sclerosis, attacks both upper motor neurons and lower motor neurons. So when I'm saying upper motor neurons, that is the spine's connection to the muscles to, if I want to reach out and grab my hat, I can reach out and grab my hat, and I have the strength and the coordination to completely do that without any interruption. Those are upper motor neurons. Mm-hmm. Lower motor neurons, they are more going to cause those fasciculations, which are the muscle twitching, but they're also going to cause atrophy. Mm-hmm. So primary lateral sclerosis, from what I understand, it only affects the upper motor neurons, which can still affect your breathing muscles, though. It can still affect your speech, swallowing, all that stuff. And you actually have a longer life expectancy than ALS. Yeah. So ALS is the more aggressive form of the motor neuron disease. Primary lateral sclerosis is not as aggressive, but, you're still going to have, at some point, you're going to deal with the same type of symptoms.
Yeah. And we also talked about the different terms of ALS. And some people know ALS as Lou Gehrig's disease.
Yep, so, it is the...
So I feel like that was what they were mostly calling it back a lot.
So that was about 75 years ago. Yeah, it was.
So
it
for
was
anybody
Lou
listening
Gehrig's
that might be
disease,
a little older, they might go, "Oh, I know what that is."
Yes, correct. It is. Yes, you're right.
ALS. I'm
it's
glad you
Lou
said
Gehrig's
the full name because I can never pronounce
Yeah.
any of it. I appreciate that. It rolls off your tongue a lot better than it rolls off my tongue. So, eventually, though, these are paralysis issues, and that's the thing. And I think there's a lot of content creators out there right now. I don't want to say a lot, but they're probably because I've been doing so much reading about ALS right now because of you, because we have this personal connection, right? And so it's intriguing to me. But also, there's people out there that are putting more stuff out on social media. Exactly. And they're documenting their prognosis, their diagnosis, their journey. And
I think the main person out there is probably Brooke Elby. She was diagnosed with ALS at a young age of, I think, 32. and now she's 37, 38. If you see this, I don't know your age. I apologize. But I mean, I do follow, her story, and, there's individuals like Brian Jerome out in Louisiana. He deals with, he shows kind of his progression. Sarah Nauser, there's another one. David, I can't pronounce your last name, but he's in California. It's individuals like that, because I mean, unfortunately, you had Lou Gehrig that came out in 75 years ago, that came out with ALS and said that, and then it disappeared.
Yeah.
Then in 2014 you had the Ice Bucket Challenge, and then it disappeared. And now I think not only these content creators, but you have Eric Dane, who is probably the biggest named individual that has ALS, that is really advocating for individuals to make sure that they're getting whatever help they can get.
Yeah.
And the unfortunate thing, like you said, is this disease isn't something that it goes away. With whatever you're diagnosed with this, and whatever individuals are going to go through a certain they're going to go through a different symptomology, because it doesn't, the hardest part with ALS is it doesn't stick to one type of symptoms. It's not like this is what you're going to have, this is what you're going to have, this is what you're going to have. This disease is sporadic, and it does what it wants, as opposed to it can affect your breathing first, it can affect your swallowing first, it can affect this first. And that's the hardest thing, is because luckily, me being 38, I was 37 at the time, but as a 37-year-old, you shouldn't deal with swallowing issues,
right,
breathing issues like that. So I was lucky enough to be like, this is not normal at my age. But everyone should know that ALS is usually an older disease. It's usually 60 to 70-year-old individuals. And the reason that they're getting diagnosed so late is because they either A, chop it up to age-related changes, that a 70-year-old would go through, or B, like we talked about earlier, is you have to rule out everything. So individuals aren't getting diagnosed, and they might be into a year of the disease, or 2 years into the disease before you're finally getting diagnosed.
Yeah.
And by that point, it's with every point of this disease, it's all quality of life. You're, like you were talking about, you're planning for the future. So the sooner that you can get in to see an occupational therapist, a physical therapist, and get like equipment devices that are going to be helpful for you and your loved ones, that's what's going to set you up for success. It's not like any other disease or any other injury where you're going in to see a physical therapist and they do their rehab and you're like, all right, like, let's get back to it. This is you wake up every day and there's some type of regression.
Yeah.
It's either a regression or it's a plateau.
Right.
You're not waking up and you're like, man, I can finally breathe again. You're waking up and you're like, ugh. Or you're waking up and you're like, okay, I feel the same.
So let's talk about that wake up, as you and I talked about that a little bit the other day. And so Chris came by on what was that, Thursday afternoon?
Thursday, yeah.
He came by, and I when I saw your initial post on Facebook, I was like, shit. I was like, no way,
Yeah.
And then I commented, like many others commented, like, hey, let me know if there's anything I can do.
Correct.
And I'm not very educated. I mean, clearly I'm a PTA, but like, there's a vast field of physical therapy, and ALS has not been one that I have focused on.
Correct. Yeah.
That way. And so I was like, I don't know what I can do, but I'm gonna do my damnedest to help you if that's the case. If we need to do something, then here I am, right? And so, you just had your birthday.
I did, yeah.
Obviously, it was Veterans Day as well, so you got the happy birthday and the happy Veterans Day.
Yep.
And then you reached out, and I was sitting here at work when you sent me a message, and you made me cry, jerk.
That's not my.
But no. What it is I mean, I've been talking to Chris about everything, because like he's my ear. Like, the poor guy has to listen to everything that I vent about. But I was like, damn, man, this sucks. And then when you reached out the other day and you asked, if this progresses and everything, like, can I help you be your voice? And what better way to do it than to to be here today
Of course.
and have this, right? But also, I'm just one of them loud, annoying people that I'm absolutely gonna put people on blast if I think that they need to be held accountable for things and help get you services. And I've got a lot of friends that are veterans and in the community, and I'm hoping that they're gonna listen to this and be like, I'm on the team. Let's go. I believe in the veteran mentality. I'm not a veteran myself, but I come from a veteran family. I got Chris. My grandfather was Navy. My brother-in-law, my little brother. All of these people in my circle are veterans, and I have great respect for that. And I do mean that when I know the mentality is I got your six, and I absolutely will help support my veterans however I can. And so knowing that, we got in here to the clinic, and then I asked you, how are you doing? And you said, well, how do you think I'm doing? But let's talk about that grieving and the daily grief that you're going through.
Yeah. Going back to it, 1 in 400,000 individuals get diagnosed with ALS under the age of 40, and you wake up and to think that you're that one is hard. And it's hard in a lot of ways, just because, just graduating and, starting the chapter of life, and then just to feel that it is just snatched from you. Right. And I understand that I'm in the beginning stages of this. There's individuals that have been diagnosed at 20 or 30 or 70, and they're at a later stage. I'm able to still function. I'm grateful for that. So I'm not taking anything away from those individuals that have been living with this disease for 5-10 years. Stephen
Right.
Hawking lived with it for 53 years.
Yeah.
The hardest thing is you wake up and it's just, you're going through the stages of grief every day, and at some point at night, I get to the point of just acceptance. And when I mean acceptance, it's not that I'm, going to go in there and take my own life as acceptance like that. It's just acceptance of whatever happens to me happens to me. But, when you wake up that next day and you're still kind of here, you just go through that same circle again. Mm-hmm. And it's hard, not only for me, but it's hard because, I'm living with my mom currently, who's 73 years old. And I think it's more hard because you just see, she's seeing her son pretty much deteriorate, in front of her. And that's hard for me because, obviously I'm not in the best of moods. So it's hard because, what are you supposed to do? Mm-hmm. I try to put on a happy face and go through the day, but there's only so many days that when you wake up and you're just like, your quality of life is taken from you. I was a very active individual. I was golfing a decent amount. I was working, and, all that stuff that you look forward to is just kind of taken from you. And it's like, what can you do? Mm-hmm. And that's another thing too, is, as practitioners and physical therapists, occupational therapists, there is no playbook on how to treat someone with ALS.
Right.
Or there's nothing, it's you do what you can do within the limits of how they feel, because A, you don't want to overtax them because their muscles aren't going to recover. And B, you don't want to you can't strengthen anything. You can maintain right. with range of motion or exercise or anything like that, but you can't strengthen anything.
Right.
Mm-hmm. So if, any practitioner or physical therapist is watching this, and they have some type of playbook, it should, feel free to either share it or
for sure. Yeah.
There should be some type of consolidation with individuals, and we should get one formed, or we should get one created, just so it's not, you're going through the motions.
Mm-hmm. Yeah.
So going through the grieving process, I wake up every day and it's like, you're depressed, you're pissed off, I wasn't a very religious individual, but obviously, throwing into the scheme of thing, it kind of brought me closer to, God. And, you don't want to cuss at him, but you're asking, like, dude, there's bad people out there. Like, why,
Yep.
why are you giving it to I classify myself as someone who is good-hearted, Obviously, I've done stuff that I'm not proud of, but I wouldn't fall into the realm of an individual that's going out there and, doing
harm.
Exactly.
Yeah.
And, you know, that's my biggest thing is like, you know, why?
Yeah.
And, you know, I talked to a buddy I reconnected with, and, you know, he said that if you're going to wake up every day and ask for the why, you're going to drive yourself crazy. Because you're not going to get an answer.
Yeah.
There is no one's going to come and tell you this is why you're going through it. Mm-hmm. And if they do, then it's going to be at the end stages of whatever you're going through.
Mm-hmm. Right.
You know, but even still, you know, as a human or just that's what I continue to ask is why, you know?
Yeah.
But
yeah,
that's the big thing. I mean, and you know, going to another thing is like people reach out and usually I don't reach back out to them. And the reason is because I don't want people to come see me when, you know, I can see atrophy in my legs or I can see this and that. Like, I don't want to be remembered as that individual, you know? So I know I have a lot of friends that if they watch this, you know, they've reached out and they are my network of people, but I just don't want to be remembered and as that. And I don't want to bring, not a burden, but I mean, you know, what do you do? I go to dinner and then they're going to be sitting there thinking like, damn, that sucks. And it's like, yeah, I know it sucks. You know, like I don't know what else you want me to say. So that's the hardest thing is I would rather just, you know, I go through this either by myself or with my mom. And I mean, it's, I know that's not the right answer, but that's just how I don't know how I'm going through it, I guess.
Well, yeah, I'm sorry for you in the sense that, you have me as a friend.
No.
And I'm an intrusive, invasive species that,
which is great. I mean,
you can't get rid of me. I'm gonna be, you know, and I know I'm gonna be more than aware of the fact that there's gonna be days where I might message you and you might say, no, not messaging back today.
Correct. Yeah.
I'll wait it out, but just remember we live in the same vicinity.
Yeah.
I absolutely hate people dropping in on me. I do. I'm like, nope, don't. Let me know, one, so I can clean my house. Two, I just don't like that. I'd rather meet people out and about or whatever. Home is my space, right? So as much as I'm an extrovert on the surface, I'm very much an introvert as well. Like I am a true Cancer. My home space is my shell. Leave me alone. Yeah. That's my downtime where I can be the not person that everybody else knows.
Yeah.
Like,
you can kind of just like shut it down.
Home,
yeah,
right?
exactly.
Yeah. I do the presentation, I'm down for 3 days.
Correct.
It's like wipes you out, you know. But I will absolutely invade you. I'm just warning you now.
And I mean, anyone that...
In a good way. If I got to drag you out by your chonies and be like, we're going out today, you know.
Anyone that has been my friend has known that that's probably the best way to either A, catch me off guard, because number one, I'm screening my phone. So I actually, I just had a buddy and his fiance stop by yesterday, and you know they knew that was the only way. They were in town, and you know I'm grateful that you know I was able to see them and all that stuff. But you know it's a double-edged sword, meaning that I'm glad that they are visiting, but it's hard to see other people continuing to live life.
Right. Mm-hmm.
And I'm not trying to be, you know, I guess that's kind of selfish to say, you know, because I want people to live their life, you know,
right.
But
yeah.
It's selfish in the fact that I'm not saying they shouldn't, you know, but it just hurts that you're unable to.
Right.
Mm-hmm. I mean, I can live my life, but I'm not able to do what I want to do. Right. And that's what I mean by that.
Yeah.
Is, you know, everyone is starting a new chapter, especially everyone that I went to physical therapy school with. And it's like, you know, everyone is starting their chapter and it's like, nope, this is what you get. And it's like, I'm not starting my chapter. I mean, I'm starting my chapter in something else.
Mm-hmm. Yeah.
You know, whatever that might be, advocacy or going through whatever I'm going through, but it's not the chapter that I wanted to start.
Yeah.
Which hurts.
Yeah.
7 years of school, and you're kind of just, you know, given the all right, awesome. Mm-hmm. Hindsight being 2020, 7 years ago, if I knew that I was going to get this diagnosis, I would have just went and lived life. I would have, you know, and that's another thing too, is like, just live life. I mean, that's people tell you that you don't really know it and you don't expect it until something kind of hits you in the face, and that's when you realize, man, I should have done this or I should have lived life. Mm-hmm. You know, so everyone thinks that they have all the time. You don't.
Yep.
And that's the most hurtful thing for me is people tell you that, and you don't take advantage of it.
Yeah.
So
I think that's something we preach in here
Yeah.
all the time. And we're preaching to the choir because it's usually a catastrophic injury.
exactly.
Yeah.
That's where you wake up and you go, oh man, I should have spent more time with my family.
Yeah.
I should have went and seen the sights. And I absolutely I advocate for people to take the vacations when they're young. Don't wait till you retire.
Yeah.
I mean, how many times do we see people that drop dead the day or the week following they retired, and then they never got it. They worked all the time for nothing.
Yep.
It's unfortunate.
But so that being said, I mean, you've already jumped out of airplanes.
Yeah, I mean,
so I can't be like,
Catch-22,
John, do you want to go skydiving?
No, I mean,
You'd push me out of the plane anyways, because that's just your go-to.
most definitely, yeah. Karate chop you out there. Yeah.
So what do we do? Where do we go from here?
You know, I think going back to the whole religious thing, you know, I think that I was never married or I didn't have any children just because I think God didn't want someone to watch me go through this or have a family to go through this, you know. Unfortunately, my mom, you know, she has to go through this with me, but I believe that, I mean, advocacy is probably going to be the best route to take from here, you know, and it's not just advocacy for ALS or motor neuron disease. It's advocacy just for the VA is just not doing a good job taking care of its veterans. That's the bottom line. Is it's not doing a good job making sure that individuals are taken care of in a healthcare network that is designed to make sure that people are set up for success when they come back from wherever or they've had these injuries. They're just not doing a good job at all.
What do you want people to know about the coverage of what? Okay, so the VA.
Yep.
ALS is 100% covered.
It is.
And the motor neuron is not.
Is not. No.
So, is that one of the changes that we propose, that they accept the fact that motor neuron is neurological?
It is, yes, correct.
And anything neurological, in my opinion, should be covered because
I agree.
Could be related to service connection. But ultimately, at the end of the day, you guys put your name on the line on that blank check.
Yep.
You could have been lost at any point in time. Your mom could be a gold star mom right now because that's a sacrifice that every single one of our veterans has put on the line. That they said, I will die for my country.
Correct.
Mm-hmm. And then we come back and we get subpar service from the veteran healthcare system.
Exactly.
So, what do you want to see change with that?
I mean, I think the big thing is I think that healthcare providers in the VA, there should be a culture shift in terms of and I get it, you know, there's a lot of burnout because you're seeing a lot of people, you know, there's a lot of veterans, but I think that the quality of care that is given at the VA is very minimal in terms of and my healthcare provider did it to me, you're not listening to the individual. You know, if an individual comes to you and they want to get outsourced to, let's just say, neurology, or they want to get outsourced to whatever, there should be no stipulation on why they can't because it's all in-house.
Right.
Oh, yeah.
So if the VA is referring someone to the VA neurologist, there should be no pushback in terms of, besides there might be a wait time,
right?
But there should be no pushback in terms of why an individual because when I wanted to go see a neurologist, I had to jump through, I had to check 5 boxes. Yeah. I had to go get an MRI, I had to go get an EMG, I had to go get this, go get that done. To go see a neurologist for the neurologist I actually haven't even seen a neurologist through the VA yet. Wow. I've only seen my ALS clinic coordinator who, you know, has worked with me to the best of her ability, but I haven't seen a neurologist through the VA. Right. Which it blows my mind.
And how long has it been since you started this process?
With the panic attack type symptoms, February, but with the symptoms of a motor neuron disease, I would say end of July.
So more than 6 months.
Yeah. So, I said, I still haven't seen the VA neurologist. And the other crazy thing is, I'm being seen at the ALS clinic as, the coordinator, is seeing me, but speech, the SLP saw me and she was the ALS coordinator, and it blows my mind that it's we'll see him, but then other departments I have to go through a certain entity. So like I said, if I wanted to see pulmonology, I had to go get another chest x-ray done. I had to wait for them to contact me.
Yeah.
And that I think it blows my mind with a 69% pulmonary function test. And I'm going to go back to that until the day that I'm on probably my deathbed, is the fact that a pulmonologist recorded that as a normal pulmonary function test.
Right.
And that has
hindered
because like I said, I went
Yeah.
to the ER the other day because I was having shortness of breath, and they told me, well, your pulmonary function test is normal. And anyone that has a background in any type of healthcare or whatever, they know that below 70% it's like you have COPD.
Right.
Or anything like that. So it's not a normal pulmonary function test, but someone marked it as, yeah, it's normal. And anyone that is watching this podcast that has motor neuron disease or has ALS or anything like that knows that breathing is one of the most important things with this disease, because it starts to paralyze your respiratory muscles, accessory muscles, and your diaphragm.
Right.
So the pulmonary function test defines pretty much like a lot of stuff, because there are surgeries that they won't do if your pulmonary function test is below a certain thing.
Yeah.
Either like a tracheotomy or a feeding tube or anything like that, because if you go under anesthesia and your pulmonary function test is too low and your muscles aren't working, they obviously don't want to take
Right.
they don't want to take the chances of you passing away or anything like that. So I mean, it hinders a lot of stuff that you should be able to get to be set up for success down the road. And like I continue to say with ALS, it's not about progressing in terms of getting better. It's about progressing in terms of setting yourself up and your family up for the next steps.
Yeah.
And if you're not set up for that, then I mean, like I told the ALS clinic coordinator, I'm doing very good at not name dropping either, because I'm not going to throw people under the bus.
No.
I'll throw the VA as a whole under the bus.
As a whole, absolutely.
Yeah.
There's absolutely an overhaul that needs
But
to
I
be
mean, I'm
taken
not
care
going to
of.
name names to throw people under the bus. But in the grand scheme of things, if I was to wake up tomorrow and I'm not able to get up out of bed or walk or anything like that, or the spasticity is so bad that I'm not able to move, it's like where do I go from there? As a terms of going back to the ER, and then so it's there's a lot of doors that are closed because of that.
Yeah.
In terms of just the ALS clinic coordinator door being open, and I can be seen in ALS clinic however many months to just see how the disease is progressing.
Yeah.
Because right now it's a question mark. I don't know how this disease is progressing. I know that I wake up and I feel weaker, or I have a lot of more tone and spasticity, or my balance is more affected, my swallowing and stuff like that, but I can't gauge how this disease is progressing because I'm not being seen there, so that way they can kind of look and say like, oh, okay, this is what you were 3 months ago, and now you're here. It's progressing slow or fast or anything like that.
Yeah.
And that's the hardest part. It's because you wake up and you're like, can I walk to the bathroom today? I don't know. Give it a try.
Have you had any falls?
I have not.
Thank
I mean, it's weird too, because at a young age you don't expect your balance. I mean, I don't know if you had like balance issues or anything like that, but
No, before. Now, yeah, due to the spinal cord injury.
exactly.
But yeah,
So I
before
mean, you kind of understand how it feels to be unsteady or unstable, or you don't feel stable. And I've never felt that before, so I don't know what it is, what I'm experiencing, but I do know that I'm grabbing onto things, and I think I'm more careful just because I know that the tone and the spasticity of my legs is just, it's rough, and that it's helping me walk. The tone and spasticity obviously helps you do your everyday life, and it helps you get around, but it's going to come to a point that the tone and spasticity is probably going to be so bad that I'm not going to be able to walk like I was walking.
Yeah. Well, you walked in the other day, and we teach the students in the clinic, observe them as they're coming in, as you're greeting your patient.
Yeah.
You start from the second you lay eyes on
Correct.
them to start tracking everything that you can possibly absorb as a sponge, and watch the way that they walk in the room and how they talk and how they respond. And Haley had come up and said, oh, John's here to see you and Val. And Dwayne, okay, all right. And then Dwayne, you were sitting, and he said, hey, come on back. And you walked in, and I watched you wobble and grab the wall. And I was like,
Yeah.
oh shit.
Yeah.
I literally was like, oh, and I was like, okay, and yeah, I was like, clearly, I mean, I can see
Correct.
things, and I haven't seen you in person in a hot minute, but I can already see things. And then we came over and chatted and everything else, and I can see those things, and I'm not a specialized
Correct.
person. I can see this, and so I know your mom can see this, and I know the people that are around you can see this. I want the VA to see this.
Yeah, I mean, it's. I think another thing too is like, you know, every time I do talk to an individual, you know, they ask me, they're like, oh, are you ambulatory? Are you able to walk? And it's like, yeah, I can walk, you know, but who knows when's going to be that fall, or when it's going to be.
You know that one.
Yeah.
She was calling for to get into PT and called a neuro PT clinic. She didn't want to come to work to do her PT, you know. That's
Yeah.
and they declined her scheduling because she's
Because
ambulatory.
they literally asked her, like, can you walk? And I'm like, yeah, but not well. And they're like, oh, well, if you're walking, we can't see you.
Exactly.
And I'm like, and I'm like, you're front desk, and you're determining if I can't get therapy based on my walking. So yeah, it's crazy that they determine that, like you
just
said,
based off
day.
of like what you say. And that's another thing too, is, you know, like even when I was going to the VA to just get whatever done, you know, being seen as a healthy 35-year-old at that time, or a 37-year-old, 38-year-old, you know, they automatically assume like, oh, this dude's all right. Because like I said, if I was sitting out there in that waiting room and you didn't see me walking or anything like that, I look pretty normal, pretty healthy. You know, people aren't going to just be like, oh, okay, like, you know, what's going on. And I feel like when I go into the ALS clinic and all that stuff, like that's how I feel like I'm being assessed off of how I'm looking, instead of them asking me, hey, how are you feeling? Or, hey, how do you feel comfortable doing this, and that?
Yeah.
And it's like, I feel comfortable, but I mean, I almost feel like it's going to come to a head to where whatever happens, and then that's when the VA is going to open their eyes and be like, damn. And, you know, that's almost the time too where like I want to go back to my healthcare provider and just say like, hey, you should have listened. I told you. I told you repeatedly that something was going on, and you didn't want to listen to what I had to say.
Current cost of a ER visit after a fall is between $20,000 to $65,000 currently.
Well, then I'll have my mom drive me to the VA because everything is covered, so they can flip
That's
that
great,
down.
but at the end of the day, they're gonna go, oh well, you know, why are you in the ER? Because I fell. Well, why'd you fall? Well, because you've been dragging your feet and diagnosing me and getting me into this clinic. You know, falls are gonna start happening.
Oh, most definitely,
and that's just what it is. And so, all right, you're ambulatory. We're gonna go ahead and put you on the back burner because you look normal.
Yeah, and
you have a fall. You hit your head. You acquire a brain injury. Now they're really gonna be catching up.
Yeah,
you know? And so those are I try not to be like, look at the worst case scenario. Like I try to be, I'm a hope dealer. Okay, that's just the way it is, right? But worst case scenario is that this gets bad, this progresses, falls happen.
Yep.
Healthcare, if you're not able to get up and you're not able to move and you don't have a Hoyer and you don't have a hospital bed and you don't have all the things in place at home, that leads to wounds, infection, death.
Correct, yeah.
I mean, so
that
it's kind of a no-brainer when you look at what conservative treatment would be. Conservative treatment is go to physical therapy, see what we need to do, assess the home setting. How do we protect you? How do we know if you're going to go down this path? How do we best protect you so you have the best outcomes possible, right? And that's what makes me so mad that they kind of ignore. And I mean, they ignore what we know.
And I mean, even being in the ALS clinic, like I'm in the ALS clinic, but I'm not being assessed by the ALS clinic, which blows my mind.
Yeah.
Because like I said, I mean, the more that I'm starting to progress with certain things, you know, I would think that the individual, the ALS clinic coordinator or something would be, you know, proactive, but she's only proactive to a certain extent. Since I don't have the diagnosis, I can't get in to be seen by the ALS clinic.
Hurry up and wait.
So it's a catch-22.
Yep.
So, you know, like I do on the 25th, I have an appointment with a neurologist that's outsourced by the VA. Tomorrow I have another pulmonary test, or I'm seeing the pulmonologist, not through the VA. But I mean, other than that, it's like, you wake up, and I try to be as careful as I am. And if it happens, I mean, I can't do anything about it.
Right. Right. One thing I recommend to you, I mean, obviously you're a veteran, you've been dealing with the VA for a while, but now that this is, you're entering this realm, is that as much paper copy as you can have, because when you do get referred out for those, so anybody who's listening, if the VA can't see you in-house within 30 days, that's where they have to refer you out. If
community
they cannot
care.
see you,
Yes.
you get referred for community care, you get outsourced out. And so please don't wait 6 months for appointments like this. If they can't get you in, say, I would like to use the community care then and be able to get seen sooner. Is that the paper trail doesn't always, the referral might be there, but it doesn't mean that your evaluations or any documentation is going to be there. So make sure you keep a paper copy to take with you when you go to see these specialists. And then say, hey, did they send over the paper? Oh, they haven't sent it. Okay, cool. Well, here's my copies.
Correct.
Please scan them into my chart. That way you have them. You're your own best advocate.
And I think the disservice too is that, obviously the veteran population is older.
Yeah.
So, and the VA went to My Healthy Vet. Mm-hmm. So everything is digital, which, technology pretty much runs the world these days. Mm-hmm. But you have a lot of individuals that don't understand how technology works or how to access their records. Luckily, me being the age that I am and, growing up with technology, I'm able to, but if you are listening and you are an older vet, just try to get on My Healthy Vet and then have someone show you how to access your records and all that stuff, so that way you can keep track. Because every documentation note that a VA healthcare provider does is put into your records.
Yep.
Mm-hmm.
So you can see everything. So just if you're listening and you're not on My Healthy Vet, there are representatives at the VA that'll help you, so that way you can get that process started.
Yeah. Okay. Oh, gosh. That was a lot. I feel like, have we educated the community?
I feel like, yeah.
I feel like y'all better be listening. You be paying attention. John, is there anything else you would like to address?
Or ask us too?
I mean, the big thing is just advocate, kind of like what you were telling me is like, if you feel like you're not being heard by your healthcare provider, there are VA representatives out there that you can reach out to that are advocates for you, but you need to advocate for yourself.
Yep.
That's the biggest thing, is advocate for yourself. And then, just advocate.
Yeah. So I will say this is not the first and only time we're going to see you. I want to make sure that we check back in here.
Okay.
And hopefully with some more answers and stuff here in a little while. You asked to have your voice heard, and if we can't hear it no more, then we're going to continue speaking on your behalf. And that was mostly what I wanted to capture today, is that
correct. Yeah.
We have it before we don't have it.
And I appreciate that,
If that's the way it's going to go. Like, if that's, I don't have a crystal ball. You don't have a crystal ball. We don't have nobody's in the room talking to us, I hope. Creepy.
I mean, they could be.
Yeah, they could be.
Yeah.
Help us out. But we don't know the path that's in front of you right now. And so the uncertainty is why I wanted to make sure we still do this while you're healthy-ish, healthier.
Healthier, yeah.
Yeah,
Mm-hmm.
so we don't lose that opportunity.
I do want to say one more thing in terms of motor neuron disease and ALS is if you are having symptoms that you feel that could be that, don't just look at the statistics and say 1 in 400,000 or 1 in 200,000, there's no way that can be me. I didn't approach it like that, so I was lucky because, being a healthcare provider and a physical therapist, I knew these symptoms. Well, I didn't know them, but I understood that this could be something. So if you are experiencing, symptoms, talk to your healthcare provider and just get seen. Unfortunately, a lot of them are going to probably discredit you because ALS mimics so many other diseases like anxiety, MS. It mimics everything, and a lot of people are going to, don't do what I did. Don't go on the forums and just kind of read, because you'll just go down the rabbit hole. But there's help out there for you if you are experiencing symptoms, but just talk to your healthcare provider.
And if your provider's not listening,
go to someone else.
Yep.
You got to advocate for yourself. Yes.
Yeah. Not every doctor is for you.
And don't be afraid to wait a couple months to get into a place. I know a lot of our patients are like, well, I can't get in for a couple months. I'm not going to go. And it's like, no, like wait and go. Like
get to a good place.
Don't hesitate. Yeah.
Or just put your name on that list and just try to find something else.
Yep.
I mean, just have your appointment at some point, and then just try to find something else. And then if you get in, then you can cancel your other appointment.
Yep. Get something on the books, because
exactly,
it is difficult to get into specialized care. And that's what
I mean,
these kind of symptoms are specialized kind of things for somebody to look at. So it takes time to get in, yes, but like I said, schedule with one. If you get in sooner, you can always cancel that one and open that up for somebody else. But make yourself a priority.
Yes.
Yep.
You know. Yeah. Okay.
Well, awesome.
All right, Morgan.
Anything else? Yeah, John, thank you so much for coming in and sharing.
Thank you for having me. I appreciate it.
Yeah, on your Sunday, and thank you to everyone who listens. And now we'll hopefully be watching this one due to Val. Not my vote, as you could tell.
Camera action.
But no, we appreciate it. And if you're ever interested in sharing your story, or any one of your loved ones have a story that you want to share, or anything like that, give us a email at you'renotalonepodcast48@gmail.com. I am getting better about checking the emails now that I'm on my computer more on the front desk. So I will keep up checking those. Also, we have Facebook and Instagram too. Val is really good at the Facebook, and we'll try to be better at the Instagram. But I know, it's me. But as always, thank you everyone for watching, and keep on us, because I know we get busy and life gets busy and we don't do the episodes. So keep on us about doing them, and we'll try.
Yeah. All right, so if you or your loved one is in need of neurophysical therapy, occupational therapy, or speech therapy, give us a shout from the hills. We are located just west of Recker and Brown Roads in East Mesa at 5761 East Brown Road, Suite 19, Mesa, Arizona 85205. Our phone number is 480-719-8080. I'm going to pause right there and say, if you do not get us on the phone, please leave a voicemail, because our voicemails come through as like a message.
Yeah.
Where they can read those out. So they're going to see them. They're going to put you in that queue of order of callback. So please leave a message. Don't just give up on scheduling. Our fax number, if you should need so, 480-981-8595. You can visit our website at neuroandbrain.com. And I'm going to lean into the camera on this one. If you are watching this or listening to this, and you can help my friend John with anything, please reach out. Either drop a comment, send me a personal message. It doesn't matter. Just get a hold of me, because we are a community, and that is what we do. And so we take care of our people. And John, you're my people. So
thank you.
I appreciate you. Again, thank you for your service.
Yes,
thank you for being a kick-ass advocate for everybody in this community, including yourself. I look forward to how we can better this together, because I mean that's the plan, right? That's the plan, Stan.
It is
to get it worked out. So thank you so much, everybody, for listening. We will catch up with you soon, and don't be a stranger. I'm Val. I'm out.
I'm Morgan. I'm out.
I'm John. I'm out.
All right. Talk to you later.